Good evening, ladies and gentlemen of the media. The Premier, the Honorable David Burt, JPMP, will give an update on COVID-19.
Good evening, everyone. And a special good evening to the people of Bermuda, and a special thanks as I begin this remark on our frontline healthcare workers, all our emergency services, and all those who are doing so much over the past few weeks to make sure that Bermuda is equipped to handle this global pandemic. As we look around the world, healthcare systems, governments, and communities are fully engaged in combating the most significant pandemic in this modern era. Almost hourly, we can see the consequences of this aggressive virus on the global community and the world's economy. Borders do not constrain this impact, and as a planet, we are engaged in a containment of transmission. Here at home, we have taken unprecedented steps to protect all of Bermuda, and especially those of our citizens who are seen as the most vulnerable. In a few moments, the official record of test results will be updated to reflect that Bermuda now has 6 confirmed positive cases of COVID-19. Out of the 4 additional cases, 1 was a close family contact of a passenger on the BA flight on the 8th of March, and 1 arrived on the BA flight on the 17th of March. 2 people arrived in Bermuda by a private jet. So those are the 4 new cases. If you were traveling on either of those British Airways flights, either on the 8th of March or the 17th of March, here is what you should know. For those of you who are on the 8th of March flight, your self-monitoring period ends today. If you're on the flight of the 17th of March, your self-monitoring period ends on March 31st. If you have not been unwell during this period, there is nothing else for you to do. If you have any respiratory symptoms or are feeling unwell, contact your doctor. Explain that you were on one of those flights and you want medical guidance. Do not go to your doctor's office or the hospital. Please call ahead. Earlier today, I met with the medical leadership of the Ministry of Health, the hospital, and the local testing facility who is conducting our local testing here on island. The ability to test locally is adding a critical piece to our ability to isolate cases of COVID-19, trace any contacts, and most importantly, enforce a regime that will limit any possible community transmission. Just as this new and complicated disease, the testing regimen is a complex one and one that is in short supply the world over. As I indicated previously, we have received a limited number of testing supplies, and there are more on the way. However, this is a simple reality. The more we test, the more we know. And it is expected that there will be more positive results in the coming days. The issue is not whether or not there are more positive results. The issue is how do we handle those? Our healthcare professionals have significantly increased the number of tests that are being conducted locally, and by extension, this will allow them to trace the contacts of those persons who are found to test positive for this virus. Thus far locally, we have tested 41 persons. We are awaiting the results of the last 30, which were done yesterday and today. However, on the first round, 11 were tested, and there was only 1 positive. Though I am confident of our ability to test will help us contain the spread, healthcare work is only one part of this. We must mount a whole island effort to make sure that we contain this virus. The term social distancing must be taken seriously, and observing these new rules of how we interact with one another will save lives. The Minister of Health signed an order on Friday closing schools, and that applies to all schools and nursery schools as well, tourist accommodation, swimming pools, gyms, beauty salons, spas, and barbers, as well as church services except funerals, sports club activities, and concerts with more than 50 people. Following today's results, to further reduce the risk of community spread, the Cabinet, which just concluded its meeting, has approved the following further actions with effect from 5 p.m. tomorrow, Monday, March 23rd. The Minister of Health will extend the closure order to include all retail stores, cinemas, bars, and restaurants will be officially limited to takeout service only. Enforced social distancing will now be limited to gatherings of no more than 10 people. The Royal Bermuda Regiment and the Bermuda Police Service will be engaged in operations directly aimed at enforcing required quarantine of persons who arrived in Bermuda since the 17th of March. Again, that is, the regiment and the police will be actively monitoring those persons who are on self-quarantine. Essential businesses only will be permitted to open and will be required to adopt the aggressive social distancing guideline now in place and on reduced hours. These businesses are banks, food suppliers or supermarkets, pharmacies, and gas stations. These outlines and guidelines have been taken from best international practice as recommended by the Pan American Health Organization. It is very important for Bermudians to note and remember that penalties are enforced for any breaking of mandatory self-quarantine, and those penalties are a fine up to $6,000 for a first offense, and in the case of a second offense, a fine of up to $10,000 or imprisonment for a term not exceeding 3 months or both. I can also advise the Cabinet met today and approved the package of unemployment benefits to be provided to those of our citizens who are out of work as a result of this pandemic. The full details will release to the public tomorrow, but I can say that the unemployment benefit will be for eligible employees not currently on financial assistance and will provide a payment of 60% of gross earnings up to a maximum of $500 per week. There may also be the opportunity to engage unemployed persons in some of the administrative tasks which are necessary to stay on top of the fight against COVID-19. With some clear basic training, some of our people who are not working right now may be able to assist. And I think it's important that we recognize that this is akin to a community effort, and this all of Bermuda is fighting a battle against the COVID-19 virus. So what I want to remind Bermudians, and this is very important, if it is not an emergency, an absolute necessity, or if you're not required to go to work, meaning that you are a part of an essential service or an essential activity, stay at home. Check on our seniors by phone or some other means that does not bring you into contact with them. If you are self-quarantined, stay there. Do not leave your home or wherever you are quarantined. Though the Minister of Finance would welcome the additional $6,000 to the Treasury, it is not worth putting the health of this country at risk. Wash your hands, wipe surfaces frequently, and make sure that you keep your social distance. It is important to note that this virus is spread by respiratory droplets, which may be on surfaces or which may be by persons who are sick. And that is the reason why we say persons that are sick, if you are coughing, stay at home and contact your doctor. But it's important for everyone to remember that it is also flu season, and so we will go through the requisite checks. It is important to note, 11 persons had enough suspicion that doctors had that they were tested, and only one of those persons were positive for COVID-19. So it is not incredibly widespread, but we are taking these actions to make sure that we take the time to allow our testing to catch up to where we are so far in the community. We are a communal and tactile people. We think nothing of gathering for lunch, happy hour, or sometimes to visit. As those interactions usually come with handshakes, hugs, and kisses, we just cannot do that right now. We must adjust, and we must continue to adjust immediately. This new normal may include the term distancing, but given the united effort required, it can serve to bring us closer together. It's important to note that these new measures that were announced today are to ensure that we can continue the aggressive testing of which we have started. And internationally, the World Health Organization and others have shown that if you do aggressive testing and aggressive contact tracing, you can break the chains of transmission. What Bermuda and the example of what Bermuda is trying to follow are the countries that have been successful in controlling the spread of this virus. References to Hong Kong, Taiwan, and Singapore. We have the ability to aggressively test here on island, and we are going to make sure that we continue to aggressively test to make sure that we can control the spread of this virus. I will give a few updates from the Emergency Measures Organization, as there are some topical matters that I'm sure people would like to hear about. Earlier today, there was an announcement from the Ministry of Tourism and Transport that the Federal Aviation Administration in New York's Air Traffic Control Center temporarily suspended aircraft approach and departure control services. Air traffic is presently unable to operate in Bermuda's airspace, and this means that flights are being rerouted through our airspace or around our airspace. This service, which is essential for flights to safely arrive and depart from Bermuda, has resulted in today's Delta Airlines and WestJet flights departing for Bermuda from Atlanta and Toronto, respectively, being canceled. The temporary suspension of aircraft approach and departure control affects all aircraft departing and arriving from Bermuda. However, it has been noted that we've just been informed that that service is expected to resume at 7:30 a.m. tomorrow, which will not affect the inbound cargo flights, which are expected to be arriving tomorrow. Government will continue to provide reduced operations at the airport until that particular service is resumed, but I'm pleased to note that we did receive a notice that that service will resume tomorrow morning at 7:30 a.m. On to the matter of education. Our public schools will launch a remote learning strategy in the upcoming week with options for a variety of learning activities for our students. These include learning packets, engagement using various learning platforms, the use of online learning applications, posting of information on school websites, and various means of communication with parents and students. The Department of Education has started to send out surveys to its key stakeholder groups, which include department staff, parents, and teachers, to find out if there are any technology challenges that persons may have working remotely. Stakeholders are encouraged to respond quickly to the survey, as this information will help the department understand what further support our private sector partners may be able to provide. The department thanks the 612 parents and guardians who, since 4:30 p.m. today, have provided feedback to the survey. The Department of Education also emphasizes that although school buildings are closed for the delivery of educational services to groups of students, teachers and staff who prefer the faster internet at school or those teachers who have limited data at home can work from their respective school site while ensuring that they practice appropriate social distancing. The Bermuda Hospitals Board has indicated that in keeping with best international practices to protect all staff, KAMH has implemented a no visitor policy except in the following instances: the partner of a woman who has given birth, the parents or guardian of unwell children, and close family members of those who are near the end of life. These restrictions are in place to help ensure the health of medical professionals and to keep COVID-19 out of the hospital and away from patients. The public is asked to help keep public areas and lobbies at the hospital as empty as possible and to practice social distancing at all times. Anyone who needs medical attention should contact their doctor first, and if they need to go to the hospital, call ahead. Of course, if you have a medical emergency, please call 911. I would just like to add that I am certainly confident of the preparations that the hospital has made for this particular virus. I am comforted to know in discussions with the top brass of the hospital that they have procured medicines in advance which have been known to be very effective at treating COVID-19, and I'm certain that if cases end up being hospitalized, then we will be able to effectively treat them. I think, however, that it's important to note that out of the 6 cases here on island, no of the cases have required hospitalization, and I think that that is a very important point. The coronavirus itself is something that will spread through our community. Our job is to make sure to limit that community spread. Most of the symptoms are mild, and most of the persons who are impacted are mild. And I would like to say that many of the persons who have tested for this virus, or we know to have this virus, have recovered. The Bermuda Hotels Association today indicated some 1,400 hotel employees have been made redundant as a result of property closures. Tomorrow morning, when the Minister of Labor, Community Affairs and Sports outlined the criteria for eligibility for the unemployment relief benefit, those hotel workers will receive their funds so they can continue to live life during this very difficult time. The COVID-19 helpline was launched at the end of the week and the end of last week for members of our community who have questions and concerns. Some 400 calls have been made to the helpline since it launched last Thursday, and as a reminder, the phone number is 444-2498. Again, 444-2498. On the issue of social needs, the government is liaising with third sector and registered charity partners to coordinate and provide assistance to those members of our community who require additional support. These activities will be coordinated at cabinet level by the Minister of Public Works, the Honorable Lieutenant Colonel David Birch. In closing, I want to say that this news that we have, that there are more confirmed cases, is not unexpected. And I will expect, as we are now making sure that we are being aggressive on testing, that that number will continue to rise. What is important and what must be recognized is that it is a responsibility of all of us to minimize community spread and to minimize any type of transmission which may be taking place. That means following self-quarantine, staying home when you're sick, maintaining good hygiene, and most of all, making sure that you contact your doctor if you are feeling symptoms. If, given the new testing guidelines which were put in place today at the meeting of healthcare professionals, where doctors are freely able to request tests for their particular patients, I do believe that with this new aggressive testing that we have here on island, we will be able to effectively control any type of local transmission. My job, our job as the cabinet and the government is to make sure that the country remains safe. And the best way for that to happen is for persons to follow the rules, make sure they observe what has been laid out, and together we will be successful in preventing a situation in Bermuda as we've seen in so many places around the world. So again, these aggressive measures are necessary, but they are necessary to make sure that we do not have to take more drastic steps later. Our job is to preserve life and to make sure that we keep our country safe, and I think we are on the road to doing that. And I want to thank the Minister of Health again for making sure that we are able to expand the testing criteria and making sure we're able to aggressively test. And I want to thank the Minister of National Security for his leadership of the special COVID EMO, making sure that we can get items in place that can help to serve to enforce the regulations of which have been maintained while also maintaining the communication for all members of the public. With that, I'm happy to take any questions that that members of the media may have.
Premier, can I ask, what is the age bracket of these persons that are confirmed?
I would love to give you that information, but I do not have it, and I believe that might be a little bit close to patient confidentiality, but I'll find out what measure of information that we can give out.
What is the turnaround time for one to be tested to results coming in?
The maximum is 48 hours. As I indicated, there were tests that were done on Friday that we have the results for. There were 11 tests that were done on Friday. Out of the 11 tests that were done on Friday, 11 of them, 10 were negative, and 1 was positive for COVID. Since that point in time, additional 30 tests have been done, and we will be expecting results of the tests that were done on Saturday, hopefully later today. And the tests that were done today, they just finished collecting, I think, 13 tests today, and we will have those by either late Monday or at the latest on Tuesday.
One more question. Many of my viewers many of the viewers are questioning those that have been tested, those that have been supposed to be quarantined, how are they being monitored to make sure that they are following your outline, meaning staying home, not coming out and infecting others?
Well, here's what I'd say. I would say that most persons are. I think it would be dangerous to say infecting others. The fact is that persons who are on quarantine are not persons that are suspected to have. It is a I understand. It is a possibility that they have been exposed. What is important is that the community is involved in this. But as you would have heard in my comments today, that the regiment and the police will be out to make sure that they are enforcing the self-quarantine. It has the impact of law. Anyone who arrived on a flight on Tuesday, the 17th, or after is required to self-quarantine for 14 days. And if you were found violating that self-quarantine, you will be charged. We are not playing. This is about people's health. And so for persons who, and what I would say is, I want to commend the Bermuda community. I want to commend our young people, because most people are taking it seriously. Most people are adopting to this new way of life as they've been back. There are some persons who felt that we should have closed the borders and not allowed our Bermudians to return home. I do not believe that would have been the correct decision. We allowed our persons to come home. We told visitors, it's probably time for you to leave. But now, in order for us to make sure that we can get through this, it is important that people observe those self-quarantine. And I think by and large they have. But if there are instances where persons are not, and if neighbors and others feel that persons are not, please call the helpline and report any instances of where you may see. And those matters will be enforced.
Any thoughts of implementing the curfew?
At this point in time, we have not considered that, but here's what I can say. With bars and restaurants and other things closed, there aren't very many places to go.
Jasmine? Premier, we have Jasmine on the line. Jasmine, go ahead.
Hi, good evening, Premier. We have hundreds of viewers watching the stream online, and for some reason, CITV feed got interrupted. Would you be able to repeat the first portion of your speech, talking about the new cases? That part was not picked up in your original presentation.
Thank you very much, Jasmine. I'm happy to report so you can be aware. Regarding the new test cases, I can confirm that Bermuda now has 6 positive cases that have been tested for COVID-19. None of the 6 cases have required hospitalization. Most of the persons who were tested are either fully recovered or recovering well. Out of the 4 new testing results of which we have, 1 was a close family contact of a passenger on the British Airways flight on the 8th of March, and 1 arrived on the British Airways flight 2233 on the 17th of March. 2 people arrived in Bermuda by private jet, and those are the other 2 persons. All persons' contacts have been traced, and any persons who are found to be suspect will also be tested. I hope that answers your question. Let me go a little bit further. If you are traveling on either of these British Airways flights, here is what you should know. If you are on the March 8th flight, your self-monitoring period ends today. If you're on the flight of March 17th, your self-monitoring period ends on March 31st. If you have not been unwell during this period, there is nothing else for you to do. If you do have any respiratory symptoms, such as a cough, maybe even a tingling throat, contact your doctor. Explain that you are on one of those flights and you want medical guidance. Do not go to your doctor's office or do not go to the hospital. Call ahead. I hope that's helpful, Jasmine.
Yes, thank you.
Would you like me to repeat what we've done so far in local testing as well, or did you get that?
Yes, please. Thank you.
No problem. Thus far, locally, we have tested 41 persons. We are awaiting the results of the last 30 tests, which were done yesterday and today. However, on the first round of testing, which was done on Friday, 11 persons were tested, and there was only 1 positive result out of the 11 persons who fit the definition to be tested.
And can you confirm whether, or rather, how many testing kits are en route to the island and when we can expect them on island?
That was part of our conversation today when I met with the medical professionals to at least understand where we were insofar of our testing capacity to make sure that we can conduct this very aggressive testing, which is necessary and recommended by the World Health Organization in order to contain any spread of the virus. What I can say is that we do have a sufficient amount of tests on island to continue our aggressive testing, of which we have, and we are expecting new testing shipments on island shortly. We're going to get a confirmation of the volume of tests of which we can do, but I am confident that we will be able to maintain this pace of testing over the next few weeks and possibly even increase it.
Up to how many tests can you perform per day?
Whoa, that number I think I got, we can go up to,
Can be or have been?
it can be, like 96 or something. The testing equipment which, the testing equipment of which the government has ordered has the capacity to do 96 tests a day. So we can be very aggressive if necessary. There are not 96 persons of which to test, but we can be very aggressive. Remember, testing, and this is important, this does not mean that we are going to test everyone. We have a testing definition which has been laid out. Doctors are aware of this new testing definition. If medical professionals, after their clinical review, have looked at a patient and say, this is a patient that I would like to have screened for COVID, they can have that test done. But this is not for persons who feel, oh, I feel sick, oh, I feel this, all the rest I'm going to get tested. It is only if it is recommended by your doctor, and your doctors will understand what is the parameters for these particular issues. We must always remember that this is flu season as well. There are rhinoviruses going around, and the testing is done on both COVID and also for other respiratory viruses, which are currently widespread in Bermuda.
Last question for you. Is the government aware of any person currently hospitalized who may be displaying COVID-like symptoms?
To the best of my knowledge, no. I did not get that particular update this morning, and if anything changes, I'll be happy to check on that to give you an update. But I had an update. There were persons at the hospital who were in my morning update, and that was not something that was raised. I do know that previously there was a person in the hospital who was on the isolation floor, which has been held for COVID, but that individual was tested and did not screen for COVID.
Thank you for your time.
Who's next? Paul?
There had been a little bit of back and forth confusion today. You can confirm for sure the WestJet flight that was due to arrive today, it's not coming?
That flight was canceled. We did send out a notice for it. That was canceled not due to the government. There's certain persons that are accused of the government. I think persons have been following the situation with staff shortages which are taking place in air traffic control in New York. That is because there was an individual there that did test positive for COVID. They are now on limited staff, and they're trying to make sure that they can ration their staff as much as possible. But I do understand that suspension will end at 7:30 a.m. tomorrow.
Do we know how many people were trying to get back to Bermuda from the Delta flight and the WestJet flight today?
We do not know. I wanted to have that information for this particular press conference. The cabinet was meeting. I know that members of persons in the the Ministry of Tourism and Transport were following up to try to ascertain those numbers and also to try to get confirmation as to whether or not those flights will be put on tomorrow so those persons who are stranded can come home. I know that a number of the family members have contacted the family helpline, the COVID helpline. That was actually how we found out that it was confirmed that the WestJet flight was canceled, but we are trying to ascertain those particular numbers at this point in time. So we can have a better understanding of the persons that are there. As soon as we have information regarding those flights, we'll be sure to publish it, and there may be information which may come to us by the time this release is over. We want to make sure those flights were requested by the Canadian Consul General and the U.S. Consul General. We are certain those flights will be put on once they're able to fly again, and we just have to confirm when that is actually going to take place.
So for those people who might be stranded, there is work underway to come up with.
Absolutely. We want to, we do. It was an unfortunate circumstance. The flights would have flown if it was not for the suspension of the air traffic control service out of New York due to staff shortages of COVID-19.
Can you just confirm the 4 new cases, just so I have it? 3 were imported and 1 was a person-to-person contact locally in Bermuda, is that right?
The way that I have described it, because there's of course patient confidentiality, it was a close family contact of someone who arrived on the island.
So would it be, that 4th one is a local transmission?
It was, yes,
Yes.
that was not an imported case. So it is not community transmission, which is important to distinguish. Community transmission is transmission that takes place in the community where you cannot figure out where it is. This was a close family contact, and so it is not unusual for there to be close family contacts where persons may be in close proximity.
Understood. And sorry if you're repeating yourself and I missed it, my apologies. The health status of those 6 people who have tested positive, how are they doing today?
No one has required hospitalization.
Okay.
Most of the persons have recovered. Yes, no one has required hospitalization at this point in time. One of the symptoms, one of the persons had very mild symptoms, has fully recovered. We have to understand that no one yet in Bermuda has been hospitalized due to any complications from COVID-19.
How many tests are expected to take place tomorrow?
I don't know how many can take place tomorrow. I know that thus far, since we had our local testing capacity up, we've done 41 tests. Given the size of our country, that is a rather sizable number if you compare that to other places. But as I said, we are going to have an incredibly aggressive testing regime that is going to take place. I met this morning with health officials to confirm that. They have expanded the testing definition. If doctors request tests, we are going to test those particular patients.
Any further questions?
And just finally, if I could, the numbers were 11 tests on Friday?
Yes.
30 tests yesterday?
No, not 30 tests yesterday. Over the last 2 days have been 30 tests. So I believe it was 17 yesterday, 13 today. So it was 11 tests on Friday, 17 yesterday, 13 today. We're waiting the results of the 17 that were done yesterday, which we should have by tomorrow morning. And then on the 13 that were done today, we will probably have by Tuesday morning.
And can I ask one last question?
Ask away. I want to make sure that we are completely transparent with the people of
Post
Bermuda.
office, the courts, what's the situation for them tomorrow?
I gave an announcement last week that I think my statement that I made on Friday gave the status of the post office, that the post office is not, so I would just ask you to refer to that, but I do not believe postal services are running at this point in time. But it's important to note that the government is not closed, and this is an important point. So persons may be, as the situation may or may not develop, that persons who are public officers may be redirected to other tasks. And I'd like to publicly acknowledge the support of the president of the Bermuda Industrial Union in his support there, recognizing that some public officers may be diverted. So for instance, if the situation has to get even further than where we are now, there will be persons in works and engineering, as I've said, that the Colonel Birch is coordinating that to help in assisting delivering meals to seniors and otherwise. So we're going to use the resources of the government to be engaged in this particular community effort, because this is not a time when we are on vacation. We are all working, and I think this is key. All of us have to work together to make sure that we can make an excellent example of Bermuda versus the bad examples in other countries which we've seen where there's been inaction and inattention to how urgent this public health crisis is.
What will it take for you to give a complete shutdown?
If we have confirmed local transmission, which is taking place where we cannot trace, then that is what will be the next step. But we have to remember, because we have such an aggressive testing regime that is now currently in place, it is our hope that we do not have to get there. It is our hope that has serious ramifications. Our main concern is persons' health, where you would see where we are thus far with basically all places of leisure which are closed, main restaurants. We are to that point of a virtual shutdown right now. The fact is, if we have to go even further, we will go even further. But the evidence does not reflect that. And what is important is that I'm taking public health advice. These are all difficult decisions. I recognize that there are many persons who wanted me to shut the borders and tell Bermudians to suffer away overseas without their families. We do not believe that is correct. I know there are many persons who believe that we should shut down entire activity inside this country for 14 days. That is not, in our view, the correct course of action. The places and actions and where that has happened is because they did not pay serious attention to this at the beginning. They did not have serious testing that was taking place inside of their communities. Neither of those are the case here in Bermuda. We now have the ability to aggressively test, and we will aggressively test. And if we find that we do need to take the next step, I can assure you, myself and the cabinet will not hesitate if that is what is the thought in the best interest of public health.
Jasmine, any final questions?
Yes, Mayor, are you able to give any more details on the point of origin of the private jets or any other additional information?
Do you know the point of origin of the private jet?
It came from the United States.
It came from the United States.
Are you able to say specifically?
I don't have that information in front of me, but I will attempt to follow up with you. But it came from the United States.
And just to clarify, you said there's been no local transmission of COVID-19?
There is no evidence of community transmission. And it is a very important distinction to state. One of these persons tested positive was a close family contact of someone who was a traveler. But it is important to note, so that is local transmission. There is no evidence of community transmission. Community transmission is when you cannot identify how this person would have come into contact with the virus.